Well, thanks all for being here today. We want to talk a little bit more about the city's response to the COVID-19 pandemic and the things we're doing to keep our staff and our citizens safe. Before we start, I just want to express my condolences on the passing of a great Calgarian, Ken King. You know, Ken's professional accomplishments were extraordinary in the media and, of course, in sport with the Calgary Sports and Entertainment Corporation with the Calgary Flames. But his volunteer work was also incredible. You know, I got to know Ken very well over the years, not just in negotiating about arenas and things like that, but in understanding that that was someone who just loved his city and loved this place and wanted to make this place better. So certainly I'm very sad today to lose a friend, and I know that all Calgarians are deeply thankful for the legacy that he's left. So we do want to talk, though, today about the city's response as an employer and as a government to the COVID-19 pandemic. I have with me today our city manager, David Duckworth, and of course, Chief Tom Sanson, the chief of the Calgary Emergency Management Agency. And I'm going to turn it over to David. Tom will then speak, and I'll say a few things at the end. David?
Thank you, Worship. Good afternoon, everybody. Thanks for being here. The COVID-19 pandemic is a dynamic and rapidly evolving situation. Our top priority as the City of Calgary is, of course, the health, safety, and well-being of not only just our employees, but also of the public. We're focusing on maintaining essential services that Calgarians rely on. At this time, all city facilities remain open, and we will communicate any changes if that changes. I have asked city employees today who have the ability to work remotely to begin working remotely starting tomorrow. I have also implemented a citywide employee travel ban for all work-related international travel. It's important that we balance the seriousness of the measures we are taking with our risk of infection, which is still quite low. With those brief comments, I'd like to now turn it over to Chief Sanson.
Thank you. I think as our city manager aptly said, our top priority is the health and safety and well-being of our public and our employees. By doing and focusing on essential services, we provide and will provide what Calgarians need. The municipal emergency plan was activated at 1:45 today. That does a couple things for us. It allows us to coordinate our own city services better. It gives us additional powers under the municipal emergency plan to secure resources. And it gives us a better clarity in decision making, really speeds decision making. And finally, it unites the city and our essential services. I can tell you that we were doing those things before. This is a more formal step to do that and to move quickly. I have been incredibly happy with how we have been collaborating in this city. It's a testament to the people who live and work here. We are incredibly supportive of the measures the province has taken. They're now restricting large gatherings, no groups greater than 250. They're limiting travel, which is good for Alberta, and it's good for the city of Calgary. They're really on top of this, and they're working hard to keep our citizens safe. If you're seeking medical advice through HealthLink, know that it takes a bit of time to get through to 811. I'm going to ask you today, please do not dial 911 as your alternative. We're seeing people do that, and they cannot give you the answers you need. A bit of a tip maybe, if you need 811 and you can't get in the daylight hours, go a little later in the night. Spread that call volume out for them. I know of an individual who called them at 3 in the morning and got through the whole process in 31 minutes.
That's me.
So we're getting overloaded with calls at 911, but we need you to allow us to focus on the emergency, the health and safety calls that 911 should truly get. Another thing, if you dial 911, if you make that mistake, don't hang up the line. You just create us more work. If you hang up the line, at least talk to us and say, I made a mistake, I should have called 811. And finally, based on the direction from Alberta Health Services, we just temporarily closed a couple of city parks. That's Devonian Gardens and James Short Park. So what we've done is we've created a bit of a SWAT team to go out and clean our public areas and our work areas when that happens. And so those sites are both clean. They're both going to be cleaned up and ready to go, and our hope is to open them again before the weekend's over. Thank you very much, and I believe that any one of the three of us remains available for questions.
Tom,
Just
can you tell us first if there are any events that have been canceled? For example, the auto show is going on right now. It's a very large crowd going through there.
Well, effective immediately, the medical officer of health for the province has limited gatherings greater than 250. I'm not sure how that's going to affect the auto show, and I'm not sure what moment that takes in effect. In fact, I've been in meetings since that happened. So that's an interesting one for us. But both myself and Dr. Etches, the medical officer of health for Calgary, have been working together. We've moved back and canceled a number of events. Green Line consultations this weekend have been put off. They were going to occur on Sunday, and we had 300 folks generally attending those, and you know, a number of those were seniors. We've moved off. I think it was the Greco-Roman wrestling. We just, you know what, people have been great. We've called them and said we're a little bit concerned about that event, and they pushed them off. The other events we're going to hold within the guidelines. I'm hopeful that the medical officer of health has done. There's some future events that we've already moved off. There was a musical group coming from an international area that had high COVID-19. We've talked them into delaying. And thanks to our friends at Mount Royal University for working with us on that. I guess that's the message, right? Calgarians have been super at working on this problem. And you might say, why? There's only been 15 cases in Calgary so far. What we know is that there will be more, and that by taking these actions now, we're pushing down on the spread of the COVID virus, and that's the important step.
Well, thanks very much, Chief. I want to be very clear on a couple of messages. This is going to get worse. There will certainly be more cases, and we will certainly have serious cases. But there is no reason to panic. As we watch cancellation of events around the world, as we see the social media posts, as we see the inexplicable lineups at the grocery stores for toilet paper, it's easy to get very, very nervous, and it's easy and correct to be looking for answers. But I want to tell you something. If you're here in Calgary, you're in the best place in the world to deal with this pandemic. We're in a place where government works. We're in a place where we have a robust public health system, and we're going to look after one another. It's important that we keep everyone safe. Ourselves, our family members, our loved ones, elderly people in the community, ultimately everyone in the community. Let me say that one of the reasons I'm feeling really grateful is I feel that we are so lucky to have the Chief Medical Officer of Health, Dr. Dina Henshaw, and her entire team, including the Acting Chief Medical Health for Calgary, Dr. Nick Etches, working so hard and being such incredible resources for all Albertans as we navigate the early moments of this pandemic's presence. Under her leadership, under Dr. Henshaw's leadership, the province is making important decisions to keep us all safe and keep us all informed, and I'm confident that we are in good shape. Now, you know, this may seem like an overreaction. And let me tell you something, maybe it is. But it is an intentional overreaction. Because when we think about how pandemics spread, when we think about that curve and that catchphrase you keep hearing, flattening the curve, it means pushing cases out further, pushing them out for when seasonal influenza cases are no longer clogging the emergency rooms, when we have more treatment and more prevention options, and overall, not overwhelming our healthcare system. These are the things we've got to do. We've got to do them quickly, and we've got to do them now, and it relies on everyone's participation in social distancing, in good hand hygiene, and all of that stuff to make sure that we are pushing out the spread of this disease as much as we possibly can. And things change. So, you know, in my own case, as you know, I travel a lot, and I certainly spend time with lots and lots and lots of Calgarians. And so although I recently returned from India, which is not considered a COVID-19 hotspot, in fact, when I left, the entire nation of India had fewer cases than Canada. Nonetheless, out of an abundance of caution, I may have had a little bit of the sniffles. I phoned 811. I did it in the middle of the night because I'm a night owl, so it took about 30 minutes to get through. And the very kind nurse went off a list of symptoms, and we talked about how I was feeling, and ultimately she said, no, you're clear, you don't need to be tested, you're good to go. And I was very happy to go through that, and I was more happy to be healthy. Maybe things will change. Today's information says people now returning from international travel should self-isolate for 14 days, even if they don't have any symptoms. So this is a very fluid situation, and it's a situation that we need to continue to look at every day. But I want people to make sure that you're taking care of yourselves. Clean hands, clear heads, open hearts. Clean hands is easy. Wash your hands frequently, use sanitizer when you can't wash your hands, cover your cough, and as you can, isolate yourself from people who are ill. And if you yourself are ill, even if it's not with this virus, stay home. You don't want to compromise anyone else's immune system. Take special care with elderly people, because as we know, this is difficult for elderly people. Oh, I should have mentioned that if you do call 811 and you do have to be tested, don't be scared to call 811. Don't think this means 14 days of isolation no matter what. It's a good process. You'll go through the list. If you have symptoms that need you to be tested, there are testing centers set up. It'll take 5 minutes to be tested. You'll isolate yourself until you get the results of the exam, which takes a day or two. But ultimately, it's a system that is working and is working very, very well. Now, the risk here is still low. And Dr. Hinshaw confirmed today that we haven't had any cases of community transmission in Alberta. That means that everyone who has it in Alberta has got it somewhere else, and they've traveled here. And the longer we can prevent that community transmission, the better we do. And that's why we're taking this intentional overreaction now. All about keeping the risk low, all about flattening the curve, all about reducing the risk by spreading out the ability for the virus to spread. It's all about keeping the healthcare system safe and able to help everyone. We can't be in a situation where someone who has a cardiac event can't get into the hospital because it's full up with people with COVID-19. So these are the things that we've got to do, and we each have a responsibility to do that. Employers, organizations, and every single one of us as individuals. So again, clean hands, clear heads. There's no need to panic, but there is a need for action. And most important, open hearts. This is a community issue. It's an issue about all of us. So go and look after the seniors in your neighborhood. As facilities start to close or as events start to get canceled, they will feel isolated. They need to know that they live in a neighborhood where people care about them. If you know people who are in isolation, drop off some soup on the doorstep. Don't go in, but drop off soup on the doorstep. Call them. Check how they're feeling. Make sure that people remember that there are other people looking after them. So clean hands, clear heads, open hearts. All right, we'll take questions now.
Are there any extra measures being taken in areas where it's not a formal event, but maybe you would have hundreds of people congregate, like a C train station between those waiting and getting off the train?
Right now, we're gonna adhere to what the medical officer of health has said, and folks who are out there who haven't dealt with this yet, you should too. That's really the message there, is that you should adhere to those guidelines. Those are appropriate guidelines. We fully endorse them.
When was the last time you put an emergency plan in place?
Municipal emergency plan would have been last put in effect for a large snowstorm that we had. I'm sorry, I'm going to say it was this fall of 2019. It was in place, yep.
Are there any measures that the city can do to help 811 process all of these calls?
I've certainly offered 811, or I really should say through my medical officer of health contact, I've offered them resources of the city if they need that to better respond. But that's a very technical response. That's when you call that number, you're generally talking to a nurse and somebody who's trained for years to be and been elevated to that position to do the phone diagnosis. So I'm hopeful that health can get some resources within, but we don't actually have a lot of nurses that we can offer.
Do you know how many staff workers, nurses work at 811?
No, I'm sorry. That'd be a better question for Alberta Health Services.
Mayor, can you explain how City Council's meeting on Monday is going to look different?
Yeah, City Council's meeting on Monday probably will look a little different because we want to model the sorts of things businesses and organizations can do to keep business going while remaining safe. So for example, we're talking a lot about if you have a work unit that is providing essential work, maybe half the people work remotely and half are together, so you don't end up getting everyone infected if, God forbid, somebody is ill. So on City Council on Monday, you are likely to see a situation where half of City Council will physically be there, the other half will be on the phone, and we are going to be experimenting with different kinds of ways to work remotely, maybe different ways of doing public hearings to try to increase that social distancing.
I'm not sure if this is a question for you or the chief, but how far into the future are you looking at city-run events that might have to be canceled?
So we have an events team that is going to be convening tomorrow to look at city events on a case-by-case basis. The criteria have certainly tightened since we canceled the Safety Expo earlier in the week. So I keep joking that team is going to have the easiest job in the world. They're just canceling everything. But that's not necessarily the case. They really will look at each thing on a risk basis using the assessment tools provided by the Public Health Agency of Canada. So for now, we're looking a few weeks ahead, but I want to be very clear about something. This is not a question of days or weeks. This is likely a question of a new normal for months. Because that curve, we have to play through it. So ultimately, it's time to start looking forward as well.
And then for the city manager, are employees who have to cancel travel as a result of the new guidelines going to be reimbursed by the city in any way, or is there any thought about how to deal with that if people have to cancel travel plans at the last minute?
Personal travel or work-related?
Work-related.
Work-related travel will be canceled. That's with the city's responsibility, so we'll be doing whatever we can to look for refunds and things like that. But the onus is on the employee to look after work-related expenses. That would be the city of Calgary.
And then just so I understand, so personal travel for city employees, like, do you have purview over that? Are you able to say, like, city employees cannot go on vacation somewhere right now? Like, or that's not a thing?
We don't really. We're offering our staff guidelines. We're offering guidelines to make sure they're looking at federal resources and provincial resources, but we have limited ability to restrict staff from personal travel. Having said that, when they return, there may be things that we'll be looking at to ensure that staff that return don't return to work if they do travel. With the mayor's comments about new guidelines that just came out, they will likely have to self-quarantine for 14 days.
It's worth noting too that just to underscore that today's guidelines from the province are suggesting that no Albertan travel internationally right now for work or for fun.
Mayor or city manager, do you have any changes planned in terms of City Hall itself? I know there are public-facing services that are offered here, but we've seen this in other places in North America where seats of government have basically been closed.
We want to remember that City Hall, I always call it Calgary's living room, and we want to ensure that people understand that their government is still functioning, that we are still providing the services that they need every day. Of course, we're going to work hard to make sure that, in areas where people congregate, where they line up to get their bus passes, for example, that we are offering other options. The bus passes is a good example. If you have a credit card, you can buy those online. You can buy them online starting early in the previous month, and they will be mailed to you. You can get your April bus passes now by buying them online. We used to have tons of services offered in person on the third floor of City Hall, things like permits and so on, that can almost entirely be done online now. And so we will encourage people to call 311 to make sure that those services can be provided. But we're not shutting down any of those services, and some of that does mean face-to-face at City Hall.
The advisory to avoid traveling outside the country, do you agree with that?
Well, I'm no epidemiologist, but ultimately we are blessed to have great public health people, and ultimately I take advice from them.
Mayor, there's also been a number of situations today in Calgary where people are basically stocking up or clearing out supermarkets. Not everywhere, but it has happened in different parts of the city, and it's not just toilet paper. Do you have any thoughts to share on that?
Yeah, look, Chief Sampson in a normal day would talk about the 72-hour kit and how every household should have 72 hours worth of supplies. In this case, it's not irrational to stock up on supplies because, look, if you are in a 14-day isolation, you got to have 14 days worth of supplies. 500 rolls of toilet paper is probably a bit excessive for 14 days. But, it's absolutely rational to do that. I mean, the great thing about today is you can get anything delivered, right? And so obviously, if you're in isolation and you're having stuff delivered, don't answer the door, ask them to leave it on the doorstep. But the good news is that we are luckily in a society where we should be able to manage that. But yeah, if people want to be careful and make sure that they're ready for should they have to go into a 14-day isolation, there's nothing whatsoever wrong with that. Look, we're going to keep the water system running. You don't have to stock up on bottled water. We're going to make sure that essential services keep working. But, you know, having a few cans of tuna is not necessarily a bad thing. Your stove's going to work too.
Mr. Lenchi in French.
Yeah.
Quel est votre message pour les Albertains qui sont inquiets face à l'épidémie de coronavirus?
I'm going to try doing this in French. Le message est simple d'ici. Les mains nettes, le cerveau clair. Uh-oh. Le cœur ouvert. Okay? Les mains nettes, le cerveau clair, le cœur ouvert. C'est important pour nous de comprendre que c'est pas un moment pour paniquer, mais c'est un moment très sérieux et il faut faire des actions comme communauté, mais aussi comme citoyen.
Oui, vous mentionnez que peut-être que vous surréagissez, mais que c'est nécessaire
C'est nécessaire de
prendre ces mesures.
C'est absolument nécessaire aujourd'hui. Parce qu'on peut dire que c'est une overreaction. Mais c'est important de faire ça maintenant parce que c'est très important qu'on a des nouveaux cas dans les plus lointains possible.
Est-ce que vous pouvez faire juste une petite réaction pour la mort de Ken King?
Oh yeah. You know, c'est très triste, vraiment. Monsieur King était un grand batteur de notre ville. Ses accomplissements professionnels étaient très, très hauts dans les médias, dans les sports, mais aussi c'était un bénévole qui fait un exemple pour nous tous. When I'm busy dealing with the pandemic, my French gets very bad. Anyway, yes.
Is there a point where a decision is made about closing libraries or those sorts of things? I don't know if it's too early to say something like
Yeah,
that.
ultimately, these are things we have to balance because services like the public library are lifelines for people. And particularly in times where you have social distance, sometimes you're going to need somewhere you can go. And so ultimately, those decisions, if they have to be made, will be difficult decisions. They will come later. That said, I know that most of our civic partners, including the Calgary Public Library, are very busy making sure that things like seniors programs might be canceled. As you've seen, we've been asked to really limit gatherings of vulnerable groups, that children's programs and camps are done in a way that is as safe as possible or perhaps canceled. So we're not at the point where we're talking about closing facilities. Today I was asked for some research and I learned that there's very little evidence that swimming pools, for example, can transmit the virus. The chlorine kills it. So we want to make sure that people are staying healthy mentally and physically. But if there is a point where the actions we're taking today are not flattening that curve and further actions are needed to flatten the curve, then certainly those are things we would look at. Okay, thank you everyone.
Thank you.
Thank you. Thanks, guys.